Welcome to Behavioral Health Today, a podcast brought to you by the Triad Network. This podcast is designed to share trending topics occurring within the world and our communities and bring them a behavioral and mental health perspective.
Welcome to Behavioral Health Today, a Triad production. I'm your host, Charlie Dixon, and today I'm joined by Dr. Jaimee Arnoff. Jaimee is a licensed clinical psychologist who specializes in CBT and pain reprocessing therapy. She brings over 10 years of both clinical and lived experience to her work, treating children, adolescents, and young adult clients who experience anxiety, depression, and chronic pain. In her own journey of chronic pain, Jaimee was diagnosed with trigeminal neuralgia and fibromyalgia, in addition to multiple other conditions that cause inflammation and related nerve pain. We're excited to have Jaimee back with us on our show today, as this will be one of our Clinician series episodes, where we take you behind the therapy door and show you, our listeners, the various therapeutic techniques, strategies, and the dynamic between the therapist and patient that can occur during the therapy session. Today's clinical series discussion will focus on pain reprocessing therapy and Jaimee's work treating clients living with chronic pain. Jaimee, thank you so much for joining us today.
I'm really happy to be here. Thank you for having me.
Absolutely. So as we have an introduction to our discussion today, can you help our listeners understand what pain reprocessing therapy is?
Yeah, pain reprocessing therapy, or PRT for short, is helping to relieve symptoms of what we understand and refer to as neuroplastic pain. And so that's a subset of chronic pain that's not caused by structural damage or tissue injury, but rather by neural signals in the brain that tell the brain that there is injury or danger when there isn't. So you can think of it sort of like as a false alarm. And PRT sessions are designed to sort of explain that process, sort of that mind-body connection, the impact of the brain to clients so that they can understand how there can be some misinterpretations that occur, and things that are maybe neutral or even safe can be understood as dangerous and then be open to exploring and attending inward to those sensations sort of curiously, rather than from a position of fear or judgment, to like turn off that faulty alarm system.
Got you. And so let's just say you have a new client that is coming in. What is your assessment process like? Help us understand what that looks like or feels like even for a new client.
Sure. Like any new client, I usually offer like a brief consultation for them to give me a bit of what's going on for them to talk with me, just to understand my background, my training, my experience before they even meet with me one-on-one, whether that's face-to-face or via like a teletherapy session. But then they'll get an intake questionnaire that asks a lot of background information that one might assume most therapists or clinicians might ask about their background, presenting concerns, history. There's going to be some more questions about medical background, because that's going to be really helpful in understanding whether or not there was a physical diagnosis or what their experience has been like with their pain. Was there a preceding injury? Was there no injury, but there are certain circumstances, settings, people, places, things that contribute to an increase or an exacerbation of their symptoms? Are there adverse childhood experiences, history of trauma, family background, mental health history, even chronic pain history in their family, certain personality traits that we might look for, people pleasing, criticism, like self-criticism, anxiousness in general. But in terms of me understanding whether or not their pain is neuroplastic, a couple of things I'm wondering about, in addition to when their pain started and what sort of causes an increase or a lessening in their experience of pain. I want to know if there is symmetry to their pain. Is there movement to their pain? Does it move around? Is it inconsistent? Typically, if there's structural damage or a tissue injury, then the symptoms wouldn't necessarily be inconsistent. They wouldn't move around. They wouldn't mirror from side to side. So if they're noticing that these things are occurring, then it's helpful information for me and maybe evidence for them that we're working with neuroplastic pain. And it's a little bit of buy-in for both of us that pain reprocessing therapy can be very effective in part of their treatment plan.
Okay. And so you mentioned that PRT is mainly used for neuroplastic pain and the treatment of such. But is there an unideal client, or is PRT useful with clients that don't have neuroplastic pain?
Well, part of the treatment of pain reprocessing therapy is mindfulness based intervention. And I think that that is something that I utilize not just with clients who have neuroplastic pain, people who experience pain in general, who have other medical difficulties, but beyond that are far reaching to my clients who just have anxiety disorders or mood disorders, because it's again, like having them turn inward, connect to their bodies, pay attention to what's happening with themselves somatically. A lot of my clients, even without physical injury, do experience headaches or panic symptoms or stomach aches as a result of their just mental health and general stress. And so being able to tune into that and having some coping skills and techniques to manage those symptoms can be really helpful, even beyond just neuroplastic pain.
Absolutely. Thank you for that. And so, what are some challenges that folks are coming to you with? What are your clients dealing with?
So for me as a therapist, I tend to be at the end of a long line of providers. I
Okay.
mean, just based on the term chronic and chronic pain, they've been experiencing these painful physical sensations for a very long time. Could be many months, could be many years.
Mm.
And so they're likely having seen multiple medical professionals and done all sorts of medical interventions in sort of terms of medications, scans, shots, acupressure, acupuncture, chiropractors, physical therapists, and then eventually they try these things and either they stumble upon some mental health providers or just are so frustrated and hopeless that they think maybe I should just check in with a mental health provider. And then they come to me. So I see that a lot, frustration, just like with the medical system and just like a loss of hope, not realizing not only can mental health services help with sort of that emotional component of physical pain, but also serve as part of the treatment plan to actually serve as effective pain management.
Yeah.
So I see that a lot. I see there's a big misunderstanding of chronic pain. And I think in general, even pain psychologists, their understanding of pain and how we understand it and how the brain is involved. And we can sort of utilize that in incorporating our tools and techniques to help them. That misunderstanding comes in a lot. So helping them understand that pain is not purely physical,
Yeah.
that it's just our brain's misinterpretation of something and not like an activity, right? People in pain sometimes avoid certain activities because they're worried it's going to hurt, or they may engage in it and it does feel painful. And so that they avoid that activity, and helping them to understand that it's not the activity itself that's harmful, but it's like the thought and the fear connected to it. And then I think there's a stigma to seeking out mental health services for pain management, because then you're sort of owning this statement that a lot of providers may have said, and a lot of clients come in frustrated to share that someone maybe gave them the inkling that this was all in their head.
Yeah.
And that feels very invalidating to them,
Mm.
makes them feel very guilty and embarrassed and ashamed. So they come in with those feelings quite often. And so letting them know that just because there could be psychological processes involved in their experience of pain doesn't mean that their pain is imaginary, and sort of empowering them to understand how the brain is involved in their
Mhm.
experience of pain in a way that again empowers them to utilize that to make themselves feel better.
Right. Right. And so in order to change these mindsets, to change maybe even the behavior of the clients that you see, I would assume that you would use different techniques and strategies, of course, to do so. I would think that some of those may be CBT, but can you discuss some of the other strategies and techniques that you use?
Yes, absolutely. I am a CBT based practitioner, so I'm always going to be like sliding in some CBT into my work. So helping them understand that like thoughts, emotions, and behaviors connected to their experience of pain can be altered and impact their overall experience of that pain. Working with them on building insight into things that distract them, empowering them and self-soothing. But similar to what I was mentioning before, that like fear of activity and engagement, I use some exposure-based therapy techniques. So emphasizing that painful activities aren't harmful, that hurt does not always equal harm, and having them sort of tune into their physical sensations in a way that feels really scary. And even though they're not necessarily doing anything active, like going for a run or a workout, or for some people, even standing up or sitting in a chair or bending over can feel really scary because that might have been the movement that first set off this physical experience of pain for them. And so they are nervous to put their body in positions that for most wouldn't feel dangerous, but for these individuals feels really scary. That's again where that like faulty alarm system comes in.
Right.
But to expose them to their internal physical sensations. And when I think of pain reprocessing therapy, I think of somatic tracking, very mindfulness based intervention. You're
Mhm.
having them start from a very basic level. For me, I like to start with something that's not necessarily connected to that painful physical sensation itself, because again, that can be really scary and likely something that a client doesn't want to start with. That's very overwhelming. So to have them run their hands under cold water and pay attention to what the physical sensation of cold on their hands feels like, and exploring that and seeing how it feels. Does it move? Can you describe the sensation? Going for a walk with them outside and appreciating the warm sun on their face.
Okay.
Then going to breathing, things that typically most of my clients don't have an issue doing, don't feel any discomfort doing.
Mhm.
So if they're going to be breathing while we're having sessions, having them really pay attention to that experience, tune into what part of the body feels most soothing, whether it's their chest when they're inhaling and exhaling, hands on their stomach when they're inhaling or exhaling, maybe through their nose when they're breathing in and out, and letting them know that they're uh, turning their attention inward, something that previously felt really scary, in an effort to train their brain to connect to these internal physical sensations that are neutral or feel safe, in a way that teaches their brain, like, I can turn inward and attend to these physical sensations in my body through a lens of safety. And by doing those activities repeatedly, they are sort of carving out this new neural pathway in their brain of, not everything that I attend to in my body hurts, and not everything that I attend to in my body is dangerous. I can feel cold water on my hands, or feel the sun on my face, or breathe in and out and connect to that experience. Again, paying attention to it, wondering if it's moving, how do we describe it? Does it subside? Does it change? Just like exploring it openly, curiously, without fear or judgment. And then that primes them to then tune in directly to those painful physical sensations. And then we would track those sort of with that same prompting. So it's sort of like a hierarchy that we would build them up to, starting with something really neutral and
Mhm.
safe, and then eventually having them connect to the painful sensations that brought them to me in the first place.
We'll be right back after word from our sponsor.
Nearly 9 in 10 registered voters believe the nation faces a mental health crisis, according to a new USA Today Suffolk University poll. Americans are more concerned than ever about their mental health. Mental health first aid provides the resources and training to identify, understand, and respond to signs of mental health and substance use challenges. It provides the confidence and skills needed to offer life-saving assistance, and it provides peace of mind. Our experts provide mental health first aid training for adults, teens, caregivers, veterans, law enforcement, EMS, and school faculty. Mental health concerns are on the rise, but evidence-based training through mental health first aid can make a difference. Visit mentalhealthfirstaid.org to find a course near you, or email hello@mentalhealthfirstaid.org to schedule a training. Courses are available for individuals, groups, organizations, and companies of all sizes. Visit mentalhealthfirstaid.org and make a difference in your community.
Okay. And so you discussed quite in depth training the brain or retraining the brain to think differently. What types of transformations and mind shifts help to actually do that, to achieve that process?
Paying attention to the pain fear cycle. So understanding again through this lens of CBT a little bit, like what we think impacts how we feel, impacts like what we do. So if we think I'll never get better and that makes us feel sad or anxious, and then our behavior is to avoid an activity or isolate, also working on flipping that mindset and thinking if I think more positively, then I will feel a little bit better and I may feel more comfortable to engage in certain activities or connect with people where that would have previously felt impossible or like something I couldn't possibly do or something I was disinterested in doing. So building that insight into that pain, fear cycle and helping them to identify what kind things they can say to themselves, what are different ways that they can understand those physical sensations, how to sort of alter their emotions so that they then therefore change their behavior, but also building insight into sort of what increases and also lessens their experience of pain. Some providers refer to it as a pain dial. So, like what turns up the volume on your
Okay.
pain and what turns down the volume on pain. I find that like using metaphor and like related terms with clients helps them. So, calling it a pain dial instead of saying like what exacerbates your pain, they're more likely to be like, okay, what turns it up? Did it turn it down? Did it turn it up? So going over the biopsychosocial aspects of what's going on for them. And that's something that I will gather during my intake paperwork, but also in early sessions. And it's something that you continuously learn about your clients, like what's their background? Are there any genetic issues? Do they have a history of tissue damage? Any like vitamin deficiencies, hormone issues? What's their diet like? Their sleep like? Their hygiene? Are there like other emotional issues that are impacting their experiences of pain that are sort of separate from the pain itself, but just happening at the same time? And socially, do they have a network of friends? Are they close with their family? Do they have hobbies, things that they're interested in? Do they like their job? What about culture, religion, their socioeconomic status? All of those things impact a person, their access to healthcare,
Mhm.
how long it took them to get to me, how trusting or mistrusting they are with the medical healthcare system. So those are all things that I think it's important to learn about, so that we can help shift things as needed. And with pain reprocessing therapy, the mindset that pain is reversible. I'm never one to talk in absolutes with clients. I want to be realistic with them, and I wouldn't want to set them up with this idea that I would be able to sort of eliminate their pain, but to explain that pain is processed in the brain and that the brain can be rewired. It's not hardwired. So just like their association to certain movement or sensations in their body make them feel fearful and uncomfortable, that wasn't something they always experienced. That was learned and built, and then a neural pathway that exists for them now. So we can carve a new neural pathway. I usually use a metaphor about like two roads that exist in the brain. one, which is this pain pathway that is newly paved. Like the white lines have been just drawn. It's well lit, perfect signage, and then this like safe, neutral road where they are sort of building up the pavement and trying to fundraise for new lights and new signs is like tuning into these physical sensations of breathing and the cold water on their hands and being mindful and leaning into these uncomfortable physical sensations to sort of repave this new road that's more neutral, that's more safe, and kind of leave this paved pain pathway in the dark. So working with them on that, again, hopefully in a way that feels empowering to them.
Absolutely. And I've noticed that you use a lot of imagery in discussion of changing and maybe even reframing the way that people, your clients, can understand the things that they are dealing with. How else do you incorporate different techniques, maybe even humor? What else do you incorporate to work with your clients?
Sure. I mean, when I think of imagery and negative imagery or like trauma and flashbacks, we understand the physical implications of that imagery: increased adrenaline, muscle contractions, heart rate. It can be very uncomfortable and felt physically. Even again, if there's no injury or pain, like clients with other mental health concerns will report these things as well. So if those negative imagery can cause those negative physical symptoms, then it should then follow positive imagery can cause positive changes, decreased heart rate, more like a more relaxed, loose body, muscular tension should relieve, stress should sort of fade away. So having clients tap into imagery that is more positive and connects to their experiences of pain, because often it is a very negative imagery that they have connected to that. Even the word pain can sometimes be language that I want to tweak with clients, because pain itself as a word has a negative connotation. And so by using that label, they're just sort of reinforcing this idea that those sensations that they're experiencing are dangerous when really they're not. They're neutral or safe. And so you might have heard me say, and I'll continue to use sometimes, like uncomfortable physical sensations or physical sensations in general. It's just something that we are feeling that is new and maybe feels unwarranted and not welcome, but not necessarily an indication of structural damage or tissue injury or harm. It's just something that we're feeling, just like I am feeling my back on this chair and like these headphones on my ears. So I think, to speak to your mind shift question before, like working on the language that they experience and utilize to describe their experiences can be really helpful.
Definitely. So, as most clinicians know, healing therapy is not a linear event. It's not like you come into one therapy session and you're just cured and everything is fine. There tends to be moments of relapse and going backwards. What do you do to prevent that relapse?
Yeah. So when we're talking about relapse and that question might come up, what happens if I feel this experience again? Will I experience this again? Especially if they've read some of the literature on pain reprocessing therapy and we've been talking about reversibility of pain. I do want to let them know that the goal is not to prevent the pain from coming on again, because they will likely experience those physical sensations again at some point, and it could be reminiscent of the pain that brought them into me in the first place. I can't promise that I will, make that disappear and hold that off forever, but it's sort of changing the way that they respond when they feel those physical sensations. So they're not as nervous about relapse. They feel ready for it. There's videos in some of the training modules for people who are certified in pain reprocessing therapy of clients sort of like standing up in sort of like a superhero pose, being like, come on, pain, like, come back. I can handle you now. I'm not afraid of you anymore.
Yeah.
You don't feel dangerous to me. I don't like the reminder of the time that I lived with you for, years of my life and what that was like, but you can't hurt me anymore. I'm equipped to handle you. So I think that's sort of the conversation that we tend to fall into when relapse comes up in session.
Got you. And I really appreciate that you prepare the clients for maybe even an eventual return of uncomfortable feelings because it may come back and you make sure that they are ready for it if it does. Are there things like a toolkit or anything for prevention? Are there apps that people can access? Or are there things that they can do on their own?
Yes, I'm a big app person. I do work a lot with teenagers and young adults who, typically have their phone with them. And I know that they might have access to those tools and techniques, even if my voice in their head isn't shouting as loudly, or they just like are so overwhelmed in a flare that tapping into those cognitive skills is much harder, which is something I'll validate for clients because, of course, in those moments, it's going to be hard to reach for the things that they've been learning about or practicing in therapy. It's all consuming, very overwhelming. And so to have access to applications, some that I use are ThinkLadder, which is like a CBT based application. They have a bunch of different sort of limiting beliefs that are shared by individuals, and you can sort of work your way through a story of challenging that negative belief with an affirmation, and you can sort of be presented with those affirmations and send them to yourself as reminders or have easy access to them when you enter the app. And I also like to use Flowly, which is a biofeedback virtual reality based app. And so clients will tune into sort of like a visual and audio scape for a few minutes at a time. Sometimes we'll do it at the start of session. Sometimes we'll do it after one of those like exposure based treatments if they are finding that mindfulness based intervention to be very overwhelming. Then we'll use it maybe after session, but in collaboration with Flowly, clients can get kits and work with it on their own, and they're sort of working with their heart rate variability to regulate themselves while they're tuning into these visual and audio scapes that they can manipulate based on how they regulate their breathing and their heart rate.
Okay.
So again, empowering them, to sort of utilize their ability to control their body to have something positive come from it. When again, there's so many negative mind-body connection experiences that they've had. So
Right.
in line with that new positive paved road.
Gotcha. And so, what do you notice when it's time to end treatment with a client? So, what does successful end of therapy look like for them?
Yeah. It's understanding the mind body connection, that pain fear cycle, that the sensation itself doesn't equal to danger. Um, but the openness that these sensations may return and that they don't have to panic. There's no urgency to get rid of it. They get to just explore it and observe it curiously because it doesn't matter. They're no longer reinforcing this idea that that sensation is dangerous. They have sort of turned off the fire alarm that was accidentally pulled without flame. And they get to, just observe and be in the experience knowing that it's not evidence of harm, that they will make it through because they've attended to the sensation before and they've moved through it and it's something they can handle. So once they feel confident in that manner, I would say we can start talking more about termination.
Gotcha. Gotcha. Makes sense. So,
Yeah.
are there certain presenting concerns or illnesses that you worked with more than others? Are you seeing more of certain things?
Sure. So because I work with a lot of teenagers and young adults, I have many clients who are athletes who have sports injuries and related in chronic pain as part of their recovery, or maybe they had some structural damage that should have in theory healed, but they're still experiencing uncomfortable physical sensations. And that's something that's really helpful in terms of PRT and people who are looking into it and wondering whether or not it fits. Because some people might say, oh, well, if it's only for neuroplastic pain, I do have a history of tissue
Mhm.
damage or structural damage. This was a real injury. These are real scans. This was something that I had to do to recover from it. However, I'm still recovering from it. Once the issue heals, it should then sort of eliminate the experience of pain. But if
Right.
they're still experiencing that pain, then these, tools and techniques will still be really helpful for them. So, injury recovery, I have a lot of irritable bowel syndrome, chronic fatigue, fibromyalgia, chronic migraines, things like that. I see a lot.
Okay. I was just going to say, so pain that people cannot necessarily see from the outside.
Yes, which is again, I think taps into the idea of it's all in your head,
Yep.
or I'm resigning myself to that idea by seeking out mental health services for
Mhm.
this experience, this physical experience. And so am I sort of giving up on myself and just like forfeiting to therapy because no one can find a physical reason or physical damage. But again, it's so, so important and something that I do with all of my clients from the very first session and every subsequent session is be very validating to their experience of pain and reminding them just because psychologically I can be helpful doesn't mean that their pain isn't valid and real.
And so, for those who may be suffering with chronic pain, can you leave us with a message of hope of what life could look like after receiving or engaging in pain reprocessing therapy?
Yeah. I mean, in addition to that, just because mental health services are helpful doesn't mean that your pain is imaginary.
Yep.
I know that it's real. I believe you 100%. And I know that I can be helpful in effective pain management based on our understanding of the brain's involvement. Therapy can be a part of your toolkit in managing your chronic pain. And we welcome we welcome you all.
Nice. And can you tell us why specifically you feel like you have a personal connection with PRT?
Sure. I personally have experienced chronic pain in varying areas of my body, started with chronic back pain. I've experienced that for well over a decade. I do also have some physical diagnoses that do come with structural damage and still, trying to find any way to find relief from that pain. I did all the research that I could. I read articles and books and listened to podcasts, and I found someone talking about pain reprocessing therapy. So I read Alan Gordon's book, The Way Out, and he breaks down sort of all of the interventions used in pain reprocessing therapy. So I decided to seek out training to see if that would be helpful, not just in my pain management journey, but if I could then use those skills and connect with clients that were in pain and be helpful as a psychologist in sort of their pain management journey. I had never even considered the idea of using mental health services in my own pain management, which just like shows you that misunderstanding and that mindset that needs to be shifted. I am a psychologist and I think that therapy is amazing for every reason, but was sitting, on my couch in pain and I never thought to myself
Mhm.
like, "Oh, maybe I should think about the psychological components and
Mhm.
how that can be used as a tool to sort of manage what's going on." And I haven't been able to stop, learning about it and collaborating with people. I did obtain my certification in pain reprocessing therapy. The training did require a lot of sort of like pairing up with the people who were also in the training, which was a combination of chiropractors, physical therapists, mental health clinicians, all
Okay.
sorts of like walks of life from psychological and medical perspectives.
Mhm.
And I found that even, you know, being practiced on and practicing on other people was helpful even in my own pain management journey. So
Okay.
I am a big believer in pain reprocessing therapy, and I'm just appreciative to be included in the list of providers that people can seek out to obtain, that type of service in their pain management journeys as well.
Nice. Thank you for sharing that. And being able to look at your personal life and use that to help others is always so fascinating to me. So, can you let our listeners know where we can learn more about pain reprocessing therapy and even your own therapy practice, BFF Therapy?
Sure. You can go to painreprocessingtherapy.com. If you are a client, they have a list like state by state of where a collection of certified practitioners who are open to taking on new clients. You can learn about their information there, contact them through there. If you are a medical professional or a mental health professional interested in obtaining training or certification in pain reprocessing therapy, you can get your certification through that website. That's like where they'll sort of advertise when the new trainings are happening. You can have like a basic training and an advanced level of training. And there's also, lists of resources and other providers, books and podcasts and things like that you can get from that website. And for me, you can go on our website, bfftherapy.com. It has a list of all of the podcasts that I've been on and all of the work and the trainings that I provide in pain reprocessing therapy and just therapeutic interventions for chronic pain for mental health professionals that are interested in maybe expanding their clientele to include that population. And check out our Instagram at BFF Therapy, where we're just posting things about what we're doing, where we're at, registration for those trainings, an opportunity to get tools and tricks from us without necessarily like being face to face with us.
Nice. Well, thank you so much, Jaimee. I have really appreciated speaking with you today.
Yes, it's been great. Thank you so much for your time.
And thank you to our listeners for taking the time to join us today. The resources for this episode and an archive of all of our other episodes can be found on our webpage at triadhq.com/BHT. And we look forward to having you back with us next time on Behavioral Health Today.
We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Triad Behavioral Health Network, all rights reserved.